Hi guys, Diwali is just round the corner, and every year during Diwali we have increasing trend of burn injuries. So I thought this is the right time to just make a few quick comments about prevention of burn injuries and first aid after burn injuries, especially during Diwali days. So coming to prevention of burn injuries, just a few quick points. Don't light firecrackers in your hands. When your kids are lighting firecrackers, see to it that they are supervised. Misguided rockets cause a lot of burn injuries, so see to it that the rockets are lighted from the terrace and not somewhere from the ground level. Then our diyas, lamps, pantis, which we call in Marathi. So these are also one of the common causes of injuries, because when we wear in our synthetic clothes and move around them, they are likely to catch fire and cause burn injuries. So take care of that. Maybe keep those lamps a bit over the side, maybe have a glass lid over it, so this way you can sort of prevent those burn injuries. Now coming to first aid of after burns. What do I do if my clothes catch fire? So first of all, don't panic, don't run. If you run, what happens is that fire gets more oxygen. More oxygen means more fire. So don't do that. Don't panic. Stop, drop, and roll at that very place. If you have a fire extinguisher, use it. If you have a bucket of water kept ready, you should keep it ready, especially during Diwali. And if you are burning firecrackers, use that bucket of water so that the fire is extinguished then and there before it increases. Now, what do I do if I get burnt? If I get burnt over the hand or that particular, or for that matter, any particular area, the most important thing what we should do is pour water on burns. Now, pour water on burns for around 15-20 minutes or till the burning sensation stops. So that is the most important thing what we should do. What pouring water on burns does is that it prevents the increase in the depth of the burn injury, so that further complications are reduced to a great extent. Then at the earliest, after pouring water on burns, remove your bangles, remove your rings, remove your bracelets, remove any particular ornaments which you are wearing. That serves two purposes. These are metal ornaments. They are likely to retain heat for a longer period of time. Once they are removed, the heat component is taken care of. Secondly, if there are rings, if there are bangles, if there are bracelets, there is likelihood that it will cause constriction and edema in the distal part. So once they are removed, that part is also taken care of. Now we see a lot of messages circulating on WhatsApp that apply toothpaste, apply egg whites, apply wheat flours, and so on and so forth. As a plastic surgeon, let me tell you that these are not evidence-based things. The best way is to pour water on burns. Now I'll tell you why you shouldn't apply all these things. Toothpaste probably gives you a cooling sensation. It has menthol in it, but it is not recommended, because if you go to a plastic surgeon for evaluation of that burn wound, if you have applied something over there, it is not easy for us, or rather it is not possible for us to assess the depth of the burn injury. So we have to clean that, and while cleaning that, it causes a lot of pain. So you shouldn't apply toothpaste, ink, oils, butter are also applied. These sort of tend to retain heat, so even these are not recommended. The best thing what you should do is pour water and burns. Just wrap that burns extremity in a very clean cloth, wet clean cloth, and consult your plastic surgeon. So that is the best thing what you can do after a burn injury. Whether you should remove the adherent clothes. So it is not actually recommended that you tear off those clothes which are adherent to the burn injury. It causes more increase, or rather depth of the burns is increased because of the avulsion part of it. See to it that you wet it and you consult your doctor. He can very gently cut it off and remove it without avulsing, without pulling off, and without causing more damage to that burnt area. Now, do I apply ice? Ice is not recommended. Ice tends to cause hypothermia, especially in small children, and it is generally considered to be detrimental. The best thing is flowing water. You can use shower, you can use taps. If flowing water is not available, take it in a mugga or a bucket or a bottle and just keep on pouring it. That is the best thing which is recommended. Now, what do I do if my pain doesn't go away even after keeping that burnt part in the water for 15-20 minutes? See, we have to understand that a burn injury in itself is a very painful thing. It is not going to go away. So, you might need to take some over the counter medications in consultation with your plastic surgeon. You can take paracetamol, brufen, whatever painkiller suits you. So, that needs to be taken most of the time to handle or tackle the pain because of burn injuries. Now, there are certain over-the-counter medications like Bernol in the old times, soframycin creams, silver-based creams. A lot of creams are available, and your doctor, your plastic surgeon is likely that he'll prescribe you, he or she will prescribe you some of these creams to apply over the burnt area. Now, this is one thing which I wanted to discuss because this application is commonly not done in the right way. So, how should it be done? How should you apply any cream which is prescribed to you? First of all, wash your hands clean with soap and water. Then make a thin layer of that particular cream over the burnt area. Just don't rub it into it. See to it that a thin layer is formed for it to be of maximum benefit. And then what we commonly tend to see is that once you apply it in the morning, and if you have been advised twice daily application, in the evening when you apply, you do the same thing. You just take that cream and start applying it over the area where the initial application has been done. So that is not recommended. You need to clean that area thoroughly. Again, put your hand below flowing water. See to it that the initial application of cream is washed off totally. Then dab the wound dry and then apply it the second time. So that is the most effective way of applying creams, especially when you are managing your burns at home. And obviously, if the burns is significantly larger, if it is severe, you should always go to the hospital and act as per the advice of your plastic surgeon or your doctor. So these were just a couple of important points, important things which you should be aware of while doing first aid of burn injuries. So Diwali is just round the corner. Have a very happy and safe Diwali. Eat lots of sweets, gain some weight, and post Diwali consult your plastic surgeons for liposuctions and not for burns during Diwali days. So take care, guys. Enjoy. Happy Diwali. Cheers.